Welcome to Dear Diaspora, a podcast celebrating the African diaspora and the change makers, innovators, and entrepreneurs working to make our world a better one to live in. I'm your host, Ndulwa Koa. Let's get started. Welcome to season 3 of the show. I am so excited to be back with brand new episodes of Dear Diaspora. If you are a new listener, thank you so much for tuning in. I really hope you enjoy the content and the episodes. And be sure to follow the podcast on social media at Dear Diaspora for daily updates and inspirational content. If you are listening to this episode the day it's released on Tuesday, November 3rd, and you are in the United States, it is officially Election Day. If you are an eligible voter, I highly encourage you to vote and show up today if you haven't already. Encourage your friends and family to do the same. There is so much at stake this year, and we have the opportunity to shift things. This country, like many others, is a work in progress, and there's just so much at stake. So please show up. Please be safe when you are out there standing in line waiting to cast your ballot, and join me in praying, hoping for, manifesting a positive outcome. And I just am looking forward to having a new president, to be quite honest. These past 4 years have been exhausting, they've been embarrassing, they've been disappointing, just all the things. And so today we have an opportunity to shift that, and I really hope that America makes the right choice. So please show up and vote today. For today's episode, I had the pleasure of having a conversation with Sam Badu. Sam is the founder of Flary, a health insurance marketplace that helps immigrants protect the people they love everywhere. So every year, immigrants across the globe send billions of dollars to their loved ones in lower income and middle income countries. In 2018 alone, the World Bank reported that remittances to sub-Saharan Africa grew by almost 10% to $46 billion. For decades, immigrants have sent money to relatives in their home countries using services like MoneyGram and Western Union. And the key issue for immigrants using those traditional methods is the lack of transparency and not knowing whether the money that you're sending back home is actually being used for its intended purpose. In comes the Flary health insurance marketplace. Flary unbundles remittance payments and basically provides a more transparent way to ensure that your loved ones back home have access to quality and affordable healthcare. So Sam was born and raised in Ghana, and during the episode, we talk about what that was like for him, his experience studying in Morocco for college, his own experience as an African immigrant here in the United States, how transformative remittance payments are to African economies and how they impact the financial security of Africans living abroad, how exactly the Flary marketplace is going to work, Africa's healthcare landscape and which countries are getting it right, and what healthcare could look like on the continent in the next 10 years. All right, so before we get into the episode, I am so excited to share that there's now a way you can officially support the show. Dear Diaspora is now on Patreon. Patreon allows you to support your favorite content creators, and in exchange, you get exclusive content only available to you via the Patreon platform. I'll be putting out bonus episodes and video interviews on there, and you also get access to podcast merch and opportunities to become a part of the show by either becoming a guest contributor or a guest collaborator. I would love your support as I continue to grow the show, so please visit patreon.com/deardiaspora. That's patreon.com/deardiaspora, or check out the link in the show notes to learn more and become a patron today. Today's episode is brought to you by Certified Africa. If you are interested in returning to, investing in, or visiting the continent, Ghana is such a wonderful place to start. That's why I'm so happy to partner with Certified Africa, a company that specializes in unique travel experiences that connect Black travelers to movers and shakers on the African continent. This December, I'll be heading to Accra, Ghana for Certified Africa's New Year's Eve in the Motherland Beyond the Return experience, and I'd love for you to join us. There will be opportunities to network with entrepreneurs, meaningful cultural experiences, and much more. Check out the show notes for more information or visit DearDiasporaShow.com to learn more. Oh, and using discount code DearDiaspora gets you 10% off the entire trip. Now, back to the show. Without further ado, here's my conversation with Sam Badu, the founder of Flary. Sam, thank you so much for being a guest on Dear Diaspora. I'm so excited to have you.
Thank you so much for having me. It's always a pleasure to talk to you. I've always enjoyed our previous conversations, and I'm really looking forward to tonight's chat. I feel honored to be here.
Awesome. Let's start by getting to know you just a bit better. I know you're from Ghana, but could you tell us a bit about your upbringing and what it was like growing up in Ghana?
So do you want like the nice part, or do you want the real part of what it's like to grow up?
All of it.
Okay. So growing up in Ghana, I did not have a terrible childhood. Contrary to what most people might think, I had a really enjoyable time growing up. My parents were a good mix between strict and allowing, almost to the point where I had fun experimenting. I spent 17 years growing up in Ghana, from when I was a baby all the way till going to boarding school for high school. And then I left at some point. Growing up was what every child back in those days will be doing. Went out so much, played soccer, and a lot more games that I probably wouldn't be able to describe in English. But growing up in Ghana was fun. I had a lot of friends. We did a lot of running around, got into trouble a lot, got beaten a lot, got into fights, all the things that you can think about. But in terms of being a child, we really were exposed to ideas, politics. I read a lot. My parents required it. The Encyclopedia Britannica was something I spent every Wednesday evening reading for hours, and I had to summarize for my dad. So my childhood was a good mix of being adventurous and at the same time being studious and more of a nerd or geek in that way.
Wow, thank you for sharing that. And so I know that you went to school in Morocco, went to college in Morocco. What kind of led you to go to school there versus other countries or staying in Ghana?
So prior to going to Morocco, to kind of understand that choice, I'd been to Adisado. So I went to high school in this super famous old high school called Adisado College. Has a ton of history. But the one thing I could say about all the people who go there is this sense of adventurism that almost borderline is dangerous, right? Bold, courageous. You always want to go do something that hasn't been done, constantly challenging yourself. So after high school, I did a year teaching, right? I taught for a year with the Salvation Army doing adult education. And then I saw a UN scholarship being advertised for Ghana, for Morocco, I mean. Prior to that, I hadn't really thought of Morocco. All I knew is, hey, there's Casablanca, there's a movie, and, Morocco is in North Africa. That's about it. Everybody was like, why would you be interested in doing that? Most of my friends went to the States for their school or went to the UK. I was really interested in exploring another African country that was making it such that, people would be willing to go study there, right? A whole UN scholarship to go to Morocco. And so that was in itself fascinating to me. for most people, it didn't make sense. My dad even got me to stay in Ghana by saying, "Hey, I'm going to pay for you to go do, business school at Legon." And I was like, "No, it's okay," because I actually had admission to either go study chemistry or go do business in Legon. Um, I rescinded both. I had registered, was just about to go before the scholarship came through. And landing in Morocco, I remember my very first day in Morocco. It was the 28th of August, I believe. And this was 2008. When I got there, the call to prayer, the mosque, the sounds, it was different. And I was in just a different part of Africa. That was exciting to me. The years that followed, not even that, the days and the months that followed were a huge cultural shock to me. Um, Realizing that I couldn't speak French, I couldn't speak Arabic, having to go into a store and point out and describe what I wanted without being able to communicate in that way, it really humbled you to see a whole different world that wasn't too far away from you, but at the same time, so foreign in that sense. Um, but at the same time, I was experimenting and experiencing this with students from every different part of Africa. We had Nigerians, Angolans, name any country that you can think about. Haitians, Mongolians were there, and that was such a cultural immersion that will later on go to shape the way I felt about Africa as a continent and thinking of myself more of as a Pan-African than just a Ghanaian, right? And that was a big, big change, that happened over that period. I enjoyed it. I loved it. There's a big part of me that still lives there, a lot of friends. And my daughter Laura was born in Morocco. So, there's a whole lot that happened there.
Wow, that is fascinating. Especially thinking back to you being like 17 and being actually open to saying like, okay, let me visit another African country, see what it's like. Like there must be a reason, um, this opportunity is even being offered. So for you to be that like open and wise at like 17 says a lot, I would say.
I don't think I was, I don't think I was necessarily wiser. I will say that, the experience was interesting. I was curious about it. In hindsight, it all seems like it was meant to be, but in the moment, it was terribly strange and nerve-wracking to be honest.
And how quickly did you learn French?
So we took 6 months of French and another 6 months of Arabic, and I had to pass both to be able to post for business school. So just about 6 to 8 months to be able to learn enough to go study, business in French.
Wow, that is fascinating. And could you walk us through what led you to move to the US and what those like early days were like for you when you first got here?
So there's a huge gap of things that happen, some of them related, some interrelated, from my time in Morocco all the way up until the US. The first time I visited the US, I was actually still living in Morocco. So that was 2010. I had family here, had come to visit. Um, it was enjoyable because it's summer and you think everything is like cool and popping in the US, right? Um, it was also interesting because that became my very first foray into being entrepreneurial. I used to move a lot of phones, electronics, just basic arbitrage. I bought a lot of stuff from here, sold in Morocco, and that was good. That was good money at that point. But at the same time, I started to identify, having grown up in Africa, in Ghana, now living in Morocco, visiting other African countries, meeting other Africans, that there was an opportunity that I was seeing in the US that you couldn't really see when you're back home. But at the same time, I wasn't ready for any of that, right? So I go back to Morocco after 2010. I come back in 2011, a little wiser, a little sharper, still dealing, still buying a few things, selling there. And then come 2012, I had to make this decision about where did I want to be? Did I want to move to the US? Did I want to stay in Morocco? Or was I going to go back to Ghana? Um, I made the decision to go back to Ghana, one, because it was better for my daughter, but most especially because I'd become involved in tech communities and nurturing communities around different ways of thinking. And at that point in time, I was part of the group that brought the second ever TEDx event to Morocco at that time, and I was doing my thesis in social entrepreneurship. I just written a publication for that. And I got hit up by a group of friends who wanted to go to Ghana and go start a social enterprise. I used to write for a UK blog, a student blog about, my travels and living in Morocco as a Ghanaian and what it was like. And they had seen some of the publications, they had seen the stuff that I thought about. And so I went to Ghana to go join Heal the World, my very first startup experience. I did that for about a year with all these young guys, extremely idealist, very optimistic about what the future was going to be in Ghana. We wanted everybody to start a business. Like, really fascinated about that, right? We go on to do some really cool things. The Heal the World, bracelets, empowerment beads, doing all of that was really great. We started the collaborative pop-ups that we became very known for. And so by the time I'd done a year and a half in Ghana, I was like, okay, I want to move on and do something else. So I move on to start my first company solo with a group of friends. So I started a company called Kitchen Experts, which was a grocery delivery company at that time. Just think about it, right? You're starting a grocery delivery company in Ghana in 2013, and you're not really thinking about all the things that could go wrong. After about 6 months, I learned really quickly, for most people, going to the mall was great. But fast forward, 3 years after that, I started another business. I started a consulting firm that was focused on helping startups and small businesses, to scale, strategy consulting. And after experiencing that for a few years, I was like, yeah, I can do this a little better. And I kind of want to be in a different place where I feel challenged, but I also feel like this is going somewhere in that sense. I wanted to not be a big fish in a small pond, which Ghana is not, but to me, it felt like, right? 26 million people compared to living in a country with hundreds of millions of people and the kind of impact that could be had. So that's what really led to the decision of moving to the US. I wanted to see a much bigger world and what I was capable of doing in it.
Wow. Thank you for providing that background and context. And so you get to the US, like what do you get into? Like, do you find a full-time job or are you still into entrepreneurship?
I'm not going to make this sound any glamorous. No, I did not have it all figured out and found some full-time job. Like, the definition of hustle is in the hustle when it comes to that, right? So when I got here, I lived in New York for a year. We all hustle, right? My first job was an internet But we were selling ISPs and domain names, right? And literally on Fordham, um, it was crazy. It was a pyramid scheme, didn't go anywhere. I got tired of it really, really quickly. Thank God I had an aunt who gave me a place to stay, food to eat. Um, that's what it was like. No glamorous craziness. I didn't have parents here, with everything set up. No, it didn't work that way. And then someone told me, "Hey, why don't you move to the Midwest and figure it out? It's cheaper. Um, there are more opportunities." So come 2015, um, I was on a bus, Greyhound, coming to Columbus. I Nothing.
Wow.
I walked every day 2.1 miles to get to Eastern Mall, asking every shop owner if I could get a job, right? Um, my first job was not in some consulting firm, until much later, right? It will probably shock people to know that I've worked in a warehouse. You know, I could drive a forklift. Um,
No way.
yeah, yeah. There's a whole lot of craziness in between that time, right? Finding your feet in America. A lot of people don't talk about it, but it takes a lot to be able to get to where you want to be, to find your place. One as an immigrant, but also as someone who is starting from scratch. It didn't matter what degrees I had. It didn't matter, like, you were just finding your place here. I became undocumented at some point in time. And you can imagine what it's like in America to be undocumented. You're a ghost, right? There's so many things that goes on that people have no idea how that works. So I'm not even going to try to sugarcoat it. Until it got to a time when I'd gone through the immigration process, it was hectic, crazy, um, but it worked out, right? I ended up joining my first startup, EmpowerBuzz, great company working on logistics solution for the local Columbus, city. And what we were doing at EmpowerBuzz was trying to bridge um, on-demand ride services that weren't Uber, but more affordable for people who worked and live out of the bus lines, like further from the bus lines.
Mhm.
Um, I think there's a company in Kenya called Lula that runs a very similar model, to what we're doing at EmpowerBuzz. Later on, I joined the military. So I joined the Army, which was really my attempt of trying to find community and belonging in America. Millions of people going through the same shared experience and sacrifice, right? You build a bond that is really unbreakable in that way, and I loved that. Plus, I also had this crazy goal of wanting to be at my fittest by the time I turned 30. So that was really entertaining to do. Um, so I did that. Finally, came back to Columbus about 2 years ago and met a friend of mine who later became my co-founder, Chad, and we went on to a venture that he had started called Restart. So that was my second startup experience where I was a co-founder at. And the goal was simple. We were going to help, financial services, hospitals, and residential real estate companies connect their customers to jobs to lower the probability of default and to avoid them going into collections. Right, this was better for the customer's pocket, but also better for the company, and also helped local companies be able to recruit talent without having a large recruiting overhead. So that was what we did at Restart until very recently, when a series of events in my own family had lost some relatives to the local healthcare system in Ghana, and it started, pulling me to focus on healthcare as a challenge that I wanted to solve. Right, I spent the last, 10, 12 years, focusing on building commercially sustainable social impact businesses. And I really believe that we could do something about increasing access to quality healthcare in emerging countries, um, like Ghana, where I'm from, in more creative ways. And that's what led, along the journey to what Flurry is today.
Wow. And so, I mean, just thinking about everything you've shared, you've been pretty much an entrepreneur your entire like adult life. Like you've constantly found some sort of problem or issue that you want to solve through um, entrepreneurship. So that's really interesting to hear. And I just can't imagine like, I mean, my mom did it, but moving to a foreign country as an adult with no network and starting from scratch, like yeah, it just says a lot about you and just everyone else that goes through that experience. Like it's not easy at all.
And I think, while we know and think and talk about immigrants, inherently, just by the action of that sacrifice, the bravery that goes into leaving everything that you know and are comfortable with to get into a new place that you know nothing about, that is something to celebrate in of itself. Without doing anything else, that itself is more than most people would ever do their entire lives.
Absolutely.
And to be able to do that for the kids, I haven't seen one of my daughters for 6 years. And that is probably the biggest sacrifice that I have had to do. When I think of everything over the last 6 years that I've been in America, that's the hardest part for me to reckon with. And think of it, people leave their families for 10, 15, 20 years to be able to make a better life so they're able to afford those people a slightly better life than we grew up with. When you look at the situation in Libya, right, I spent a year working for an NGO called Comité d'Entraide Internationale. It was a German NGO based in Morocco and other um, North African countries dealing with sub-Saharan Africans who are trying to go to Europe. When you hear firsthand accounts of the people who die walking through the desert, the people who get sold into slavery, right? The people who get killed fighting amongst themselves, the pseudo chieftaincies and hierarchies that are built in these nationalities and these immigrant camps, right? The sexual abuse. When you hear stories from people talking about what it is like to try to get into Europe and any other part of the world, you have to pause, take a second, think about the fact that they're not just making a journey, they're making a choice to leave something, somewhere, someplace where they identified the majority of their life with. And that's what really causes you as an African to sit back and think, you know, as an African, are you really doing any more to make life better for the people who are African and the people who live in Africa? And if that answer is not a yes, right, then you have some reckoning. It's easy for us to read it off and just check boxes and say, this is terrible. But it's terrible because we're all complicit in the Africa that we have.
Wow. Wow. I mean, absolutely. Yeah, everything you mentioned about um, the experiences people have trying to leave their home countries, it really makes you think about what conditions people are living in and how bad they must be, essentially, for them to even consider going through those experiences they have attempting to leave. Because I'm assuming most people would know that it's not going to be easy to get to Europe, for instance. But the fact that people are actually willing to make that sacrifice and just try, I think says a lot.
100%. And I doubt the gravity of that is something you read out of a book, in school. No, you have to like meet someone to know what it's like.
Absolutely. And I mean, even I think was it last year when people started talking about Libya and what was happening, um, and the conditions people are living in. But it's like after that first broke out, I think last year, it's like nobody's really talking about it. It's like one of those things that, oh, it comes up, we're concerned, and then we move on to the next thing.
It is unfortunate that to be African, we don't identify ourselves and everybody else, right? The situation in Libya did not start 2 years ago, 3 years ago, right? It's been there for the longest time. It's gotten worse, aggravated with the demise of Gaddafi, right?
Mm.
Um, it's definitely gotten worse. And as you think of it, we are people who haven't prioritized ourselves yet. Right? There's so many examples that you constantly see a reaffirmation of the fact that Africans haven't prioritized Africans in our deal making structure, in our government contracting, in the way we win business, even amongst ourselves, in the way we patronize businesses, right? Who do Asians buy the most from? Who do Indians do most business with? The whole continent. We're going to see what the ACFTA, brings about. But in reality, the fact that trade volumes within Africa are significantly lower, intra-Africa compared to ex-Africa, we have to understand that we as a people have not prioritized valuing ourselves as a people. And until that happens, you water a flower because you care about a flower. Americans love their dogs, and so they treat their dogs well, right?
Mm.
Do Africans love themselves, and do they treat each other well? We don't.
Yeah, that's a great point and something that I'm sure most of us have observed. And it's really unfortunate that that's the reality in a lot of cases. I wish we were more pro us, and us first. Definitely something to really reflect on. And so you move to the US, no network. But as you kind of start to meet other people kind of experiencing the same things you are, what are some of the issues that you identified as far as just the African immigrant experience and what we're often having to do to essentially provide for our families back home? Like, what are some of the things that you've been able to observe?
So I'm guessing you're talking about like remittances and how we support family back home.
Yes.
If there was anything that was unifying about the immigrant experience, it's how much we cherish our family back home, depending, of course, to the kind of relation that it is. Um, I have both my parents who live in Ghana. I have my siblings who live in Ghana, tons of relatives who live in Ghana. And so for me, that is top of mind all the time. Right? I also know a lot of people from different African countries, even from different parts of the world, who prioritize their families and their ability to support them in the same way. That's the immigrant experience. It's the whole point of leaving, actually, that we live slightly better to create this opportunity. And so the people that we leave behind are a little better off, right? We pave the way, we become naturalized. So other people now have a path to residency and citizenship, you know. But at the base of this comes down to how we provide that support. For a lot of us, that looks like a trip to the Western Union, you know, using MoneyGram or downloading an app like WorldRemit or Remitly or any of those. And while we sometimes do that mindlessly, you know, it speaks to something greater, right? It speaks to this interest, no matter how fragmented, that immigrants have in the people who are in the countries that they've left, whether it's for familial reasons, whether it is for business, whether it's to have a place that we can go after we retire and leave here, whether it's for holidays. We're transacting with the continent in different ways throughout our lives here. And that's the one thing that I noticed, right, being here. Um, Whether it's for healthcare, or we're sending money for school fees, or we're sending money for a house. Those are the different ways that we're doing that. But the even larger part of what I noticed, and I'm pretty sure a lot of people know this, is this gap in transparency that exists when it comes to remittances. First of all, there's really no way of knowing that when someone asks you for money, for whatever reason it is valid, right? You don't know whether, you know, Jack saying, hey, Granny is sick means Granny is actually sick. You could be getting pictures of a house when you think you're sending money for your cousin to build a house for you. It happens all across Africa, right? They could be telling you that your mother has been sent to a hospital, where what they really mean is she's been sent to a herbalist, right? You don't know that. You could be sending money for shoes, but you're not really determining what shoes they're getting. And this is just a gap that exists because two people live in two different places, and there's this inaccessibility to the same information. At the same time, there's also a visibility problem that when someone actually gets you to send money, because that's the primary way by which we support people back home, when you send the money, you have no control and no idea where that money is going to. So they said grandma was going to go to the hospital. Did grandma go to the hospital? What was the diagnosis and what happened at the hospital? What hospital did she go to? Right? You're going to rely on someone giving you that information, and sometimes it's imperfect. You're going to send money to that Western Union, and then you hope that the person who goes to pick it up is going to actually, you know, give the money to the person that you wanted the money to go to. You know, gone are the days when we mostly sent money through our friends who were traveling back home because transaction fees were this high, right? And over time, as transaction fees have lowered, they've done a lot for the accuracy and the speed of getting money and resources across, but they haven't done much for the transparency and the visibility and control that you want when it comes to fulfilling remittances. And that's something that I believe is really interesting, and we're going to see more of that people are tackling in the next few years, right? Um, that itself opens up to the larger conversation of what do people in the diaspora represent for Africa? It's the same across different kinds of markets, but for Africa, it is significant, right? The figures support it, and there are lots of ways we can see that the diaspora, in my opinion, represents the largest opportunity for Africa to scale, you know, and grow over the next few years.
Absolutely.
Yeah, I mean, when we first spoke, you had some really great data that you shared. I think the figure in 2018 was that we sent about $46 billion to Africa. And how often are people sending money back home, would you say? Is there data around that?
Yeah, there's a ton of data. The U.S. Census Bureau does a lot of work. The UN tracks remittances um, insanely. There's a lot of data around what remittances are going to, how they're being used in the economies that they go, what percentage of GDP they represent, you know, what it means to a country to be able to receive remittances. On average, immigrants in the US, right, are sending between $300 and $400 every couple of months. But when we talk about sub-Saharan Africa and Africa in itself, you have 2.8 million out of about the 48 million immigrants who live in the US sending money to Africa. Now, comparatively, that's a small percentage, right? Latin America represents, and Mexico as a country represents about 30% of the immigrant population here.
Mm.
2.8 million is very small, but it means a lot, right? 2.8 million people in 2019 sent about 48 billion, and we're just talking the US to Africa.
Wow.
And then you look at like a cross section of that and you look like Nigeria, right? Where you have close to a million or less than a million Nigerians who are sending over $6.8 billion to one country, right? And
Wow.
it is huge. Over 7 times Nigeria's foreign aid, about 11 times its foreign direct investments, right? When you think about that, that is huge. Now, outside of the fact that you see it as a figure, what does it really mean in terms of value and impact? And that's where the opportunity really is. Can we connect the value of the remittances that are being sent to the impact that the country is having or the impact that it's having on the country where it's being sent? And that's something that I think for a long time we haven't really thought about, we haven't calculated for, and we haven't focused on addressing. It's part of the reason why um, we haven't taken as much advantage as we should have taken about it.
Absolutely. And could you tell us a bit about what you're building over at Flary and what problem you are aiming to solve?
So, Flurry is a cross-border insurance platform. It's a marketplace that allows immigrants in the diaspora in the U.S. To be able to compare and buy health insurance in their country of origin, so that their families and their loved ones in those countries are able to access healthcare. So you're buying health insurance here to cover your family back home. Um, the bigger problem that we're solving, right, is increasing access to quality healthcare in emerging countries without adding the burden of affordability. That's the big vision, right? If we would have done something in the next 10 years, that's what we hope we would have been able to achieve. Um, on this side, though, the immediate problem is bringing peace of mind. What we're solving for is to bring peace of mind and financial wellness to immigrants who have to support their families and loved ones back home, right? We're solving the problem and the challenge around taking care of your loved ones in the countries where you left when it comes to healthcare, right? And that's what we're solving for. That's the problem that we're solving here.
Wow. This, I mean, after coming across just your work and what you do, I think this is just an incredible solution, a much needed solution. After doing like a little bit of research, It's just crazy to think how much like healthcare costs back home are covered just out of pocket, you know, um, and how paying for, medical expenses really can be like what leads people just, deeper into poverty, because, insurance isn't widely available. Could you paint a picture of what, I guess, the healthcare landscape is like, let's say in Ghana? How are people typically accessing healthcare? How many people are covered by insurance? Um, I'd love if you could speak to that just a little bit.
So, healthcare itself is big business, but healthcare is necessary everywhere. Now, just like every other service that is essential, someone's got to pay for it. Now, determining and being creative around how healthcare gets paid is how economies do better than others, right? We can look at what some countries spend per person on healthcare and how they budget for it compared to where, what places like Ghana and Nigeria are spending for their citizenry. Healthcare in Ghana and on the continent is mostly paid out of the pocket of people who want to access it. And for a lot of people, it means that they will delay accessing healthcare for as long as they can. It leads to a lot of problems that we'll get back to later on. There's a typical system that is called cash and carry. You need the money to be able to access healthcare, right? You have to pay for it and you have to have it before you get the care. It's not like here that I could go to an Ohio Health and I'm going to get taken care of and we'll deal with the financing later, right? In places like Nigeria, it's as high as 78% of that cost of healthcare is going to come out of your pocket. In places like Ghana, it's around 48%. We think that's good, but we know that there's a whole lot more that has to be done, right? And countries have gotten creative about it, trying to create their own universal healthcare programs, right? Ghana has been touted as one of the most successful. And while on paper, we say that about 40% of the people in Ghana have access to the National Health Insurance Scheme, the reality on the ground, and you talk to anybody, is quite different, right?
Mm.
What is it covering? Is it acceptable? Would you be able to walk into a hospital and you'd be giving care? Outside of common headaches and colds and stuff like that, going to get pain medicine, what are you going to do with that? How much health care does it allow you to be able to access? Those are the tougher questions that we need to ask the people who live there to get a good idea of how effective that is. But healthcare in most African countries is driven primarily by people having to find that money somewhere. And where it connects to us is the migrant families who have to get a call at 3 a.m. or midnight in the middle of a night shift, having to send money home for an emergency. And we're not even talking about preventative healthcare, which is like a whole different beast that we don't even mention, right? Where there's nothing visibly wrong, but you know that you have to go get checked, right? And that's what the situation is like. Long waiting lines, people dying while waiting, people hoping to see the doctor because they don't have the money. It goes on and on and on. And there's research after research that's been published. What maternal health outcomes are, right? The rise of communicable diseases that are easily treatable, but most people live without knowing or having a diagnosis for, right? The state of healthcare in emerging countries isn't great. The state of healthcare in Africa is even worse.
Mm.
And that's what we think that is worth focusing on. Solving those big challenges is an opportunity as well.
Absolutely. Wow. Yeah, I mean, after the research that I did see that, Rwanda is really praised for
Yeah.
how much coverage, the
Hmm.
citizens have. And I think the figure's at like 90%.
Yeah.
But after your point about, okay, that's what it is on paper, like we don't know for sure what's covered essentially.
Rwanda is exceptional. I will say that. Out of all the countries that are implementing universal health insurance, um, Rwanda stands out, right? Santé Publique has been really, really well done. The way they financed it, allowing companies to be able to take a part of the cost of the burden, um, that's innovative. But of course, time will tell. But as we see with a lot of things, Rwanda is taking the lead in Africa in how innovative and how much they put their people front and center of the decision making, right? And much of Africa has a lot to follow and understand. South Africa is around another one. It spends close to 40% of its budget on healthcare. That is very, very exceptional to the
Mm.
rest of the continent.
So tell us a little bit about how Flary will work. How much do you have to pay every month to be able to access it and ensure that people back home have access to that health coverage?
So Flurry, first of all, is a marketplace. So there's a lot of reasons why we decided to approach that way. And primary is knowing that people have different budgets and different ways of caring for their families. But the one thing that is true across board is they all care about their families. So having variety and giving choice was important to have on the marketplace. It's the reason why we didn't go with an exclusive partnership with any one insurer. So across 5 different insurance partners that we're going live with, Flary covers 54 countries in Africa. In those countries, what we're doing is bifurcating the consumers of the insurance policies, right? The coverage, the people who are the policy holders from the people who are paying for the coverage, the policy owners. The policy owners are people who live in the diaspora, typically out of their country of birth, paying for the insurance for a loved one who lives in that country. So for a Nigerian who lives in the US with a mother in Lagos, you're buying and paying for your health insurance premiums over here the same way you would for your own medical insurance, so that your mother who's in Lagos now has an ID card that she could walk into any hospital and receive care. She could go in and go see a doctor for a wellness check, right? That's how Flary works. And in terms of the practicality, so a migrant goes to our website, fills in some information about the person they want to cover, where they are, what their budget is, what kind of benefits they'll like them to receive, what known pre-existing conditions they have. This is going to give you a number of relevant insurance policies from different insurers that match the needs that you've just specified. Select one of them as it fits your needs. Go ahead and complete a secure purchase, which will then trigger us to go through underwriting for that person. We'll do verification in the country and then issue out a policy for that person. They get an ID card. The policy duration is for a year, and they have coverage a year up to the limits that you specified. It's super simple for the person who's receiving the care and takes only a few clicks on the part of the person who is in the diaspora for that to happen. And you're paying with a bank account, a credit card, or a debit card in just as easy as the way you do any other transaction.
That is so awesome. And I mean, a lot of young people listen to this podcast. Like, would a 25-year-old be able to afford this, or is this kind of tailored for maybe older, more established
So I'll
people?
say it's a cost of about 2 Netflix subscriptions, right? So it's not crazy. If you think about it, we have policies that range from about $20 if you break it out. All policies are annual. So if you break it out into premiums, you're looking at from $20 to $50, all the way up until, policies that cost about $250 a month, depending on what you're looking for, right? For most people, about 80% of the people, their relatives will never have to travel outside the country where they live. There are some people who want to be able to take their parents to India for treatment, or to South Africa for better care, or even bring them to the US. That's where it starts to get expensive. But for the majority of people, you're receiving care from local providers in the country that you're in. And these are all private hospitals. This is all private insurance, right? So they're getting care there, and it's pretty affordable. Right, you're paying between that $30 to $50 a month in premiums, and the question always goes back to, how valuable is your mother's life? How valuable is your father's life? Right? Could you spare $400 to $500 paying for that, or would you rather spend $2,000 for a health emergency, or someone gets into an accident? And these are inclusive of medication, surgeries. It's inclusive of your lab tests. So this is comprehensive insurance, and it's all direct settlement. So it's not like deductibles and all of that. Your family back home will not have to spend a cent, complementing what you're buying for them.
Wow. I mean, this is going to be a super powerful just resource for people. I mean, my mom's experienced, the health emergencies where you're kind of having to scramble and, send like an unbudgeted amount of money to family back home. So this solution, being able to guarantee that, your family back home has coverage, and you're not having to worry about, the random emergencies. I think that's going to be just a really great thing for people to be able to access. So super excited for you, and super glad that this is going to be available to people. And how do people, where do you go? Like if you want to sign up for Flary, and has it launched yet, or it's happening soon, correct?
So Flary actually launches on Thursday. We've been in private beta for the last month, right? So while we've already been selling policies, we haven't been open to the public. We've really been getting the kinks ironed out, working around the little issues. But come this Thursday, if you have family in Africa, you should be able to get a policy on Flary, right? And what I will say is, it's not just for the people back home. Think of the pandemic that we're going through, and the fact that I know a lot of immigrants who've lost their jobs, right? I know a lot of people who've been laid off have had to take double jobs. But at the same time, we have relatives back home who are dealing with shutdown economies. Most of them can't work. My mom runs a restaurant in Ghana, and like you can imagine, nobody's going there to eat, which means that you have to support a lot more as an immigrant, your family. How do you take on this added responsibility while you are in a place where you're losing, your financial stability? It means that something has to give. And what we see as that give is by focusing on the essential care that goes back home in a much more efficient way. So what we're saying is, instead of going to pay 9 to 12% to Western Union or whatever app you use, and sending $300 or $400 every couple of months, take a $450 policy, pay that $40 or $50 a month, but then you're going to be receiving about 4 or 5 times that in coverage, and giving them the most essential health. Who pays when they have to get a COVID-19 test? How do they go to the hospital when they don't feel right, but there's nothing immediately visible happening? How do they know that they have diabetes? How does someone know that they have hypertension if they don't ever get a check? How do you know that you have high blood pressure or high cholesterol? All of those things that are just common to us over here, that you get a check every twice a year or so, right? But back home, people are waiting until emergencies. And that means that the likelihood of survival reduces versus people who are very much aware of what their health conditions are, right? And that's what we want people to think about. You can either invest in them having quality health, or you're going to be paying a lot more in funeral costs, down the line, right? So we want immigrants to put more money in their pockets. We want the other Africans to put more money in their pockets, because instead of you sending money blindly, you're sending a predictable budgeted amount, and you're able to take better care of your family here.
Absolutely. Wow. And yeah, again, like I said earlier, this is such a smart solution. I mean, we're already sending money back home, some of us monthly or even more often. So why not ensure that, the funds that you're sending are, actually being used the way you intend for them to be used. And so, yes, thank you again. And I would love to just get your take on what you think healthcare in Africa will look like in the next 10 years. Like, we've seen examples of, countries like Rwanda just being super innovative as far as just finding ways to ensure people are covered. But what are some things that you're observing that you've come across that you think will really shape healthcare in the next decade or so?
Healthcare in the next decade in Africa is going to shift focus from treating, communicable diseases um, and huge pandemics to dealing with non-communicable diseases, lifestyle diseases, right? We're already starting to see those trends. Africa is insanely import driven, which is sad, but it also means that we're importing, along with all of those things, the diseases of the West. People are preferring to eat imported chicken, which has stayed in the fridge for months in China, than a locally produced chicken, organic chicken, which we will turn around and pay twice or three times as much for here. All those things are going to contribute to where our efforts around healthcare is going to be. We're going to be dealing with more obesity, right? We're going to be dealing with more hypertension. We're going to be dealing with more heart problems. We're going to be dealing with more gastro issues. And it means that a lot of our effort needs to shift towards prevention and awareness and preventative care and checks rather than curative care. And I don't think everybody has realized that yet, or we will be changing our focus. We've taken this approach to building huge, memorable, expensive, flashy surgical centers, when really what we need in Africa is more primary care centers. America is a clean example of that. You're seeing a push from Walmart and CVS into having more small clinics. There's a reason for that, because the research shows us that if we focus on helping people avoid getting the bigger things, we're generally more healthy for it, and we spend less in those ways. We need to realize that. Plus, healthcare is not charitable work. It's a big business. If people are paying $10, $20 to stay healthy a lot longer, it's a lot better than waiting till they pay $10,000 just to avoid dying, and then living a life full of complications years after.
Mm.
We need to train our doctors differently. We need less specialized doctors and more general care medicine. We need to empower health workers and nurses to be able to take on and do more. You don't need to be a doctor to figure out that someone with diabetes needs to be on these treatments, take insulin, avoid these foods. If we had more nutritionists, they'll be helping people be a lot healthier. So our whole psychology around healthcare in Africa has to change if we're noticing what is happening. So that's where I think it's going. And then when it comes to financing that healthcare, I truly believe that companies like Be My Microinsure are best positioned and way more creative around solving that than incumbents are. We have huge challenges, and so it means our solutions will look different from what those solutions look like in countries like the US. It's the reason why BIMA has sold 11 million policies in the last 24 months, because people can understand their day to day finances, but people can't understand what 30 days of their finances look like in a continent where over 76% of the people work in informal trade activities. That's what we need to be paying attention to. And the people who solve those major challenges creatively are the people who would unlock value, as are the people who will unlock value in agriculture, in our education, right, in our transportation and logistics, and then in our financial sectors. Those are the drivers of growth for Africa and where the big opportunities really are.
Wow. Um, you can definitely tell that you've spent some time thinking about that and what healthcare could look like and should look like on the continent. Definitely brought up some great points about more like we're focusing more on preventative healthcare. I think that's just globally that's super important. And if we actually figure out ways to focus on that, we will have less incidents of people, having heart attacks when they didn't know that they even had, heart issues or, things like that. So, yeah, thank you for sharing your thoughts on that. And let's end by on a positive note. I'd love to hear what excites you about Africa's future.
Now you're talking. Um, what excites me about the continent is, crazy people like me, who are willing to not look at all the challenges and all the craziness that's going on the continent, but focused on unlocking opportunity. You know, people who are building innovative companies for the next decade, right? People who are solving financial access, healthcare. I can name off 100 entrepreneurs right now that are working on all these crazy ideas for what Africa could be. It seems almost unreal that people wake up every day excited to go to work, to face all these challenges. Um, the age of Africa's population excites me. From an insurance standpoint, it is great because you have a generally younger population compared to the West. It means that if we're doing things right, and if people are living healthier, better, would actually be paying out less claims. It means that people would be, incurring less of the huge losses and more of the maintenance things. It also means that we have an opportunity to create value for longer because the future is in Africa. That all of the challenges excites me because it means that for every single one of those challenges, there is a solution out there. Look at Nigeria. They're moving to a point where all of its oil could be processed and value added without ever having to ship it off. It's a huge project, But Dangote has spent years solving for the big problems, and now he is a lot more capable of solving for this one.
Mm.
As internet access increases on the continent, it unlocks even greater value for what Africa is going to be able to do. Talent is everywhere, opportunity is not. And with the internet and its rise, we see that opportunity becomes a little bit more equitable for Africans everywhere. And then finally, what excites me is the diaspora. We saw last year the year of return, and this year our motto is, beyond the return. As Africans in the diaspora and immigrants in the diaspora realize their power and their ability to influence a continent's direction, a continent's project, their progress, their growth, that is going to be a whole different Africa than you know. A day when we crowdfund for the next road, for the next bridge, for the next hospital that we build, for the next farms that feed our people. We have the power. We just have to figure out how to use it.
Thank you so much, Sam. I definitely agree that this is a really exciting time, and just being able to connect with super innovative people and kind of just share your stories and hopefully inspire even more people to kind of start thinking that way will lead to just a more prosperous continent, I believe. And so I'm so happy about what you're building, and I can't wait to share it with others. And yeah, thank you so much for being a guest.
Appreciate it. I appreciate you having me. Thank you for the conversation. I get super passionate about Africa, but if I'm not passionate about Africa, where else am I going to be?
I really hope y'all enjoyed that episode. Tell everyone you know about Fleury and what it's going to do to transform healthcare for our loved ones back home. Be sure to visit joinfleury.com. The link to that is in the show notes as well. Today's episode is brought to you by Certified Africa. If you are interested in returning to, investing in, or visiting the continent, Ghana is such a wonderful place to start. That's why I'm so happy to partner with Certified Africa, a company that specializes in unique travel experiences that connect Black travelers to movers and shakers on the African continent. This December, I'll be heading to Accra, Ghana for Certified Africa's New Year's Eve in the Motherland Beyond the Return experience, and I'd love for you to join us. There will be opportunities to network with entrepreneurs, meaningful cultural experiences, and much more. Check out the show notes for more information or visit DearDiasporaShow.com to learn more. Oh, and using discount code DearDiaspora gets you 10% off the entire trip. Thanks for listening to Dear Diaspora. If you like what you hear, please rate the show and leave us a review. If you really like what you hear, become an official supporter of the show by visiting patreon.com/DearDiaspora. Appreciate you tuning in, and we'll talk to you next week.